The world is in the throes of the most complicated immunization drive in history. COVID-19 vaccines are in high demand and relatively low supply as the race to produce the shots and get them into arms everywhere heats up. This week, we look at how vaccination rollouts are going in African countries, as well as an important discovery made in South Africa that could tell us where this pandemic will take us next. Hello and welcome to the show. I'm Haydé Adams FitzPatrick. Thank you so much for joining us. We begin in South Africa, which has been especially hard hit by the coronavirus. That country has recorded the highest number of confirmed cases and deaths in Africa. And now it has kicked off the continent's largest COVID-19 vaccination campaign. As Anita Powell reports from Johannesburg, it's been a rocky road to the rollout.
It took a year, but now a future looks possible. South Africa only started rolling out the coronavirus vaccine in the last 2 weeks, but President Cyril Ramaphosa says they've taken off running, with more than 67,000 health workers inoculated in the first 10 days as part of the first stage.
The start of our vaccination campaign has so far gone extremely well. It has shown that we can achieve much when we work together as a government, the scientific community, the private sector, and community-based organizations.
The second phase will start as soon as late April and will include the elderly, essential workers, and those who work or live in institutions, and those with other health risks. In all, South Africa hopes to vaccinate 40 million of its nearly 59 million people. Dr. Richard Lessells, one of South Africa's top viral researchers, says he thinks authorities made the right move in stopping use of the AstraZeneca vaccine because it was not found to be entirely effective against the highly contagious variant that has driven most of South Africa's new infections. In all, the nation has seen more than 1.5 million confirmed cases. And he says South African regulators are looking at other vaccines, including those made in Russia and China.
Clearly, there was a lot of concern about us being late to the party and late getting started. The reality, however, is that whether we'd got started earlier or not, the vaccination wouldn't have impacted on that second wave that we saw, that really dreadful second wave, because that was already in motion in December. What's critical now is to get vaccine into as many people as possible before any resurgence and any possible third wave.
He also said researchers are working to develop a vaccine against the highly contagious new variant. In Johannesburg, the nation's economic hub, residents had mixed feelings about the vaccination campaign.
This vaccine is going to help us for this virus of coronavirus and what. It's going to help us, this vaccine. Because many people here in South Africa died because of this virus.
I don't think I'll be taking the vaccine anytime soon. Regarding why I say so, it's because of the fact that it hasn't been proven anywhere else in the world. If we had to be the first people in South Africa to be taking this vaccine, what does this mean to us as South Africans in general?
The Rainbow Nation has a long road ahead. But, says Ramaphosa, this is a country that has known hardship.
Now, a year after the virus first reached our shores, we have a much clearer path towards containing infections and ultimately overcoming the disease.
Shot by shot, he says, they'll get it done. Anita Powell, VOA News, Johannesburg.
The next time there's talk of scientific breakthroughs in the fight against COVID-19, remember this name, Sandile Cele. The young South African scientist is making global headlines for making an amazing discovery. Remember that COVID-19 variant first detected in South Africa? Well, Cele has discovered a way to grow that variant in a lab. Scientists say it provides important insights into where this pandemic is going next. Cele spoke to me from Durban, South Africa, and explained what it all means.
Our group is amongst the first groups that founded antibodies from people that were infected with the earlier variants. these antibodies could not bind well to the new variant. Then what makes our work different from others is that we're not using a pseudovirus. We are using a live virus that we were able to isolate from infected individuals. We started receiving blood samples and swabs with infected viruses from individuals around the hospitals. There was this emergency of a new variant. We knew that we needed to get this in the lab so that we could further study it and understand it and do all sorts of experiments on it. So I think it took us about 14 days to get this growing in the lab, and then another week to see how well antibodies bind to the new variant.
What does this discovery mean for the world of science? And then what does it mean for ordinary people?
We are now able to grow or culture these new variants as they come, so that we can study them and see how they react to different antibodies. We can also use these variants in the lab to test for vaccine efficacy. Like you can get blood samples from vaccinated individuals and then see how well these recognize the new variant. And shows the ordinary person that the scientists are really hard at work, and we now have this virus in the lab, so we know what we are dealing with, so we are better equipped in terms of dealing with it.
Sandile, what do we know about where this pandemic is going next, and what is it that we still don't know?
With all these emerging new variants, we've also learned of a new variant coming out in Uganda and Nigeria. All I think we need to do, like globally, we need to increase genomic surveillance so that we pick up these new variants and deal with them as they come up. And also, there's long COVID. There's an issue of long COVID. I think we still need to do more research to see what are the factors that influence one to have these symptoms of COVID months after infection. As scientists, like, we are doing our best, but we also need the community to do their part. The only way to fight this and to end this pandemic is through vaccination. So we have to do our part and get vaccinated.
And that was Sandile Cele from the Africa Health Research Institute speaking to me from Durban, South Africa. Ghana made history recently when it became the first African country to receive the COVID-19 vaccine through the COVAX vaccine sharing initiative. Experts say it's an important step because vaccine distribution to date has been far from equitable. The World Health Organization is now trying to reduce the divide between countries that can afford to buy up vaccine doses and those that can't. VOA's Steve Baragona has more.
600,000 doses of the AstraZeneca Oxford University COVID-19 vaccine. COVAX, the International Program for Vaccine Equity, delivered the shots to Ghana. They're the first in its pledge to deliver 2 billion doses worldwide this year to countries regardless of income level. It's a historic moment, UNICEF Executive Director Henrietta Fore said, adding that it's making good on a promise that people from less wealthy countries are not left behind. But it's more than that, says World Health Organization Director General Tedros Adhanom Ghebreyesus.
This is not a matter of charity. It's a matter of epidemiology. Unless we end the pandemic everywhere, we will not end it anywhere.
Dangerous new variants of the virus can arise anywhere the disease is spreading. A variant first found in South Africa is already weakening the vaccines. The G7 group of high-income countries this month committed $4.3 billion for COVID vaccines, tests, and treatments. President Joe Biden has joined the program, reversing his predecessor's policy.
The United States is making a $2 billion pledge to COVAX, with the promise of an additional $2 billion to urge others to step up as well.
But the program remains $23 billion short.
Alrighty, there you go.
And COVAX is competing with other countries for scarce vaccine supplies, says International Rescue Committee Health Unit Chief Mesfin Tessema.
The goal is noble, but it is actually standing, in the long line and at the back of the line, and that means that even though they have the money now, by the time they receive the doses, it will be much, much later.
And some wealthier countries are cutting the line, making deals with manufacturers that undermine COVAX, the WHO's Tedros says.
Even if we have the funds, we can only deliver vaccines to poorer countries if high-income countries cooperate in respecting the deals COVAX has done and the new deals it's doing.
The first doses are arriving in low and middle-income countries, but experts say it will be months before they catch up to wealthier nations. Steve Baragona, VOA News.
Well, some countries' immunization campaigns have been complicated by vaccine mistrust. In Senegal and Zimbabwe, health officials received their shots in public to help counter vaccine hesitancy. The two countries have begun inoculating their citizens with China's Sinopharm vaccine. As Mariama Diallo reports, officials are trying to allay fears about its efficacy.
In Zimbabwe, Vice President Constantino Chiwenga, also the country's health minister, volunteered for the first Chinese-made vaccine as well. Amid reports of public mistrust over vaccine safety, Chiwenga said his ministry had done its homework.
My ministry conducted all scientific processes to ascertain the efficacy of Sinopharm vaccine, which was confirmed to be 79%.
Zimbabwe received 200,000 doses from the Sinopharm vaccine as a donation from the Chinese government. Another 600,000 doses purchased by Zimbabwe are expected to arrive early next week, according to government officials. Vaccine recipient Michael Chideme says he's relieved to have taken the shot, but
taking the jab does not mean I will not get the disease if I don't practice caution. But I'll be extra cautious, but I'm happy I've taken the jab.
Zimbabwe, like many other African countries, initially recorded low coronavirus numbers in the first months of the pandemic, but subsequently saw cases go up. Mariama Diallo, VOA News.
Still ahead here on Our Voices, getting ready to travel again? You'll probably need something like this before you hop on a plane. We'll also speak to an expert about black market vaccines and what you should look out for. We'll be right back. You're with Our Voices. Welcome back. What does the COVID-19 vaccine mean for the future of travel? If you're hoping to hop on a plane after getting your shot, there's something you might need before you pack your bags: proof that you are fit to fly. Governments around the world are looking at introducing digital health passports.
A short form, a number of health-related questions, a quick shot, and then a vaccine card. That's the standard process when someone gets a COVID-19 vaccine in the US. The vaccination card is a small paper that the health professional fills out by hand. Maryland school teacher Maral Sivaslian got one recently.
She told me I can't lose it. I have to have it, and I have to make sure I take it with me when I get my second dose.
The vaccination card is a reminder that in 3 weeks it's time for the second dose, but also a backup for the nation's electronic record keeping.
So everybody who gets a COVID-19 vaccine in the US, in the state that they're in, that information gets electronically put into the registry.
But Tan says he believes the vaccination certificate can easily be falsified and wants a new system the World Health Organization is considering.
I think there has to be validation. There has to be a way to validate that information, which is why I think having something that is digitally secure, which is what the SMART certificate that WHO is looking at, is needed.
The World Health Organization already has a so-called yellow card, which essentially serves as an official vaccination record needed to enter certain countries. The idea is to do the same for COVID-19 vaccinations. The International Air Transportation Association is suggesting a vaccination app.
Travel Pass is essentially an app which will be designed to be downloaded on a customer's phone, either directly from Apple iOS or Google Play for Android, or through an airline's app. And eventually that would allow a customer to be able to digitally identify themselves.
The International Economic Forum is also working on developing a similar digital passport, an app called Common Pass. It's an IBM platform to store all the medical data.
So in the US, everybody is required to send the vaccination activities to the state. And the state keeps this information into a registry. And what we are working on now is connecting the platform to the registries, so we can also expose that information back to you.
But relying on an app worries human rights activists, who stress that not everyone has a smartphone.
Connecting vaccination with the need to have an expensive smartphone doesn't serve civil liberties or civil rights purposes.
Developers say the apps should be fully functional by the end of 2021. Officials say a lot depends on how fast vaccinations are administered around the world and when countries reopen their borders. Valesya Bakalets in Washington, NRI's VOA News.
And Rwanda Air is set to become the first African airline to roll out that IATA travel pass. The Rwandan airline will begin a 3-week trial next month for customers traveling between Kigali and Nairobi. As communities and countries vie for access to COVID-19 vaccines, criminals could be spotting a range of opportunities. Law enforcement agencies around the world are bracing for a coronavirus black market. Interpol has already warned countries to be on the lookout for organized crime groups that are falsifying, stealing, and illegally advertising vaccines. Earlier, I spoke to Lenias Hwenda. She's an immunologist and founder of Medicines for Africa. She's also an expert on promoting fair access to safe medicines. Hwenda says black markets present a significant challenge.
The market conditions themselves, where you have a lot of shortages in countries with weak regulation and weak enforcement, high prices that countries have to pay for those vaccines, makes them a perfect target for illicit trade. In fact, as we speak, the WHO, Interpol, Europol, and the FBI have all issued warnings that the great demand for these vaccines, for COVID and flu vaccines as well, is likely to fuel criminal activity relating to falsification, to theft, to illegal vaccinations. As long as shortages persist and there aren't enough vaccines for everybody, and you make that a condition for travel, this problem is only likely to grow.
So, Lenias, how would an ordinary person know that they're getting a substandard or falsified vaccine?
I think there are some red flags that people can look out for that could warn them whether the vaccine they are about to be offered might be substandard or falsified. For instance, by simply just following the national news, a lot of countries don't have vaccines yet. So you would know whether there's vaccine in the country or not. And if obviously somebody is offering you a vaccine, and you know there isn't any vaccine yet in the country, then it's obvious you have to ask, where are they getting from? These vaccines are very scarce. They are going to be under very tight control and security measures. So I think most countries are going to issue a list of approved vaccination centers where people can legitimately get, a vaccine that is approved.
Now, of course, we're going to be working with vaccine certificates and potentially passports. Do you expect counterfeit vaccine certificates and passports becoming as big of a problem as counterfeit vaccines themselves?
If countries make vaccination certificates or vaccination passport a condition for accessing services, for instance, within a country, employment, or even at a global level, international travel, whilst most people are still not able to get the vaccine, then falsified certificates are likely to become a very big problem. But otherwise, if they continue to be used for basically monitoring who has been vaccinated, who hasn't, and who needs a follow-up dose, those kinds of things, then they are unlikely to become a problem bigger than the falsified vaccines themselves. For these certificates, the use of vaccination certificates to work as a tool for public health control, you would need to have or to issue people with the kind of proof that is not easy to falsify, possibly incorporating maybe some biometric elements, maybe blockchain technology that cannot be easily altered. That certificate would have to capture information that would be acceptable to all authorities. And you have countries that are very different with different technological capabilities. I have been involved in negotiating these kinds of, things to get countries to agree what standard everyone is going to follow. And it's not an easy undertaking that can be done overnight. So a major undertaking, major investment, and it will take a long time to come up with something that works for everybody.
And that was Lenias Hwenda from Medicines for Africa speaking to me from Geneva, Switzerland. We're going to take a short break here, and when we come back, we'll look at what life is like after you get vaccinated. We'll also bring you the story of a group of Kenyan acrobats who are lighting up traffic in Nairobi. Stay with us. We're bringing women's voices to the conversation, and more than that, we're building a community of inclusion and empowerment.
Here in Kinshasa, campaigns to raise awareness against the spread of coronavirus are common, but getting that information to people who have no access to water, electricity, or money can be a challenge.
We are here at Kalerwe Market in Uganda, Kampala, where in this whole market, women are crying out for their situations to change.
For women, it will be better for us.
I think a big thing for me is just being able to say that when these protests are happening, does it turn around into policy?
Our kids are raped every single day.
This movement got the government to listen. It really was powerful because it showed what is possible when men and women band together and say enough is enough.
It's not necessary anymore to climb on a car. I can be in any place to cheer with the people.
You're with Our Voices, welcome back. So you've been vaccinated against COVID-19. Now what? What changes? What stays the same? And one can't help but wonder, what does normal even look like now?
You might be done with the COVID vaccine, but that doesn't mean you can start ignoring face masks and social distancing, say doctors. All the safety measures must stay in place.
I work in a rehab hospital, so we treat a lot of patients post-COVID who are just deconditioned, very weak, still on oxygen. So we still are going to use our masking policies. We're still going to use N95s when necessary, and we're still doing social distancing.
That's because doctors say it's still not clear if someone who had the vaccine can still spread the virus.
You may still have a little bit of virus that isn't hurting you, but it's being spread if you cough or sneeze or talk closely to someone.
Doctors urge people who have been vaccinated to continue all the usual safety measures.
We wish to keep promoting wearing the mask in the general community. We can't have some people without masks and some people with masks. That's too confusing. Wearing the mask should be the socially normal thing to do for a while. We will let you know when you can throw away the mask.
Doctors also note that a single vaccine does not guarantee someone won't be infected and caution there are new and evolving COVID-19 strains.
There's some evidence that the current vaccines are effective, but there's concerning new evidence that maybe not as effective against the South African variant.
Scientists also don't know how long the vaccine is effective, but some restrictions can be relaxed.
Suppose you want to get together with grandparents or others. If they are vaccinated and you are vaccinated, then you can get together. But suppose only they are vaccinated. Can you visit them? I say yes, but still be somewhat careful, right?
Doctors can't say for certain just yet when life will go back to the pre-pandemic normal. At first, they emphasize that it's important to get as many people vaccinated as possible. For Lisa Bakalets in Washington, Anna Rice, VOA News.
With COVID-19 guidelines banning large audiences, some Kenyan performers have taken to the streets to earn a living. One group, the Clan Acrobats, has been entertaining motorists stuck in traffic. Michele Heisler reports from Nairobi.
Being stuck in Nairobi's notorious traffic can be boring, but the Clan Acrobats are making it much more interesting. Due to the COVID pandemic, they have taken their act outside, performing for a captive audience waiting in traffic.
Us like acrobats, we deal with gathering, where people should gather. We entertain the big crowds. Now due to this COVID-19, people can't gather together.
The ban on large gatherings has hurt the income of many Kenyan performers whose normal venues have shut down. The Clan Acrobats are managing to get by, entertaining motorists with different degrees of gratitude.
The good thing is they're waiting for the traffic lights when they are red. That's when they do the thing. When the traffic lights are green, they move.
Kenya's Bureau of Statistics says unemployment has doubled under lockdown measures meant to stop the virus.
The youth unemployment before COVID was high, and during the COVID it has gone so much high that a number of youths that I know that we work under has lost job opportunities.
After a long day performing in traffic, the Clan Acrobats help train the next generation. 10-year-old Alvin started with the group 4 years ago.
I want to be an acrobat when I am older because it is my talent. I want to earn money so that I can help poor people.
To keep themselves out of poverty, the Clan Acrobats plan to keep performing for motorists while they wait for a green light on pandemic restrictions to be lifted. Mogelwa Hlachwayo for VOA News, Nairobi.
That is our show this week. Thank you so much for watching. We'll see you next time. Goodbye.